We have room for maybe one or two questions. So if anybody.
Can I maybe just add that I will make my presentation available online for those who might be interested, because I strongly believe that we're doing some really innovative and really interesting work in the Ottawa region. So follow us on Facebook, and we'll post both French and English presentations there so that you can access it, and then you can contact us if you have any questions.
Go ahead with the first question.
This presentation was billed as a Pan-Canadian Community Alliance, which is a noble undertaking and unfortunately underscored a lot about the differences in the provision of healthcare to our community, to any community in this country. And interestingly, to me, didn't even mention the entire northern tier of our country, in the same way that when you ask people here in British Columbia, have you been north? The answer is, yeah, I've been to Prince George, which is the actual center of the province, not the north begins with Prince George. It seems to me, despite the fact that provision of health care is a provincial matter, and despite the fact that the provision of health care within the provinces varies by health region, I live on Vancouver Island. I feel Island Health is probably the idiot of the health authorities in terms of taking leadership roles. But I was struck at an earlier conference when we had a doctor from Northern Health speak. And I have no education in this field. I have no paid work in this field. I only get this voluntarily and listening to people. So the determinants of health was something new to me. And given the geographic context of our country, why don't we have a geographic determinant of health? And why, since we are all, regardless of whether we live at the border, whether we live in the true north, don't we have the right to a bare minimum of common base health care, regardless of our population? And then we get the add-ons and the richness that comes from agglomeration of people. I find this so patently unfair to people who don't live near the 49th parallel. And we don't seem to be making any great strides in democratizing our provision of health care, whether it's around HIV, whether it's around gay men's health in general, women's health, Indigenous health, whatever.
Thanks for your comment, Andrew. And I think the point that you're trying to make is a very critical one. And I think that was why we sort of named the geographic challenges for this alliance as sort of being one of the kind of key limitations, and one of the things that we've already identified as something that we need to do in terms of trying to broaden the scope and the reach of what we're trying to do. I think it is important to recognize that, you know, in the context of national projects in gay men's health, this is, I think, taking a big step forward in terms of, you know, broadening the reach, you know, outside of Montreal, Toronto, and Vancouver, and Ottawa, and, you know, including, you know, all 10 provinces. But I think your point is totally well taken, that, you know, we need to be thinking more broadly, broadening the network of different partners and communities that we are working with to ensure that, like, we are truly achieving a pan-Canadian kind of impact. So, you know, like, we're sort of limited by some of the resources and the constraints through you know, just getting this grant together. But I do think that one of the things that we would like to do is, and that we're continually trying to do, is consider how we can sort of leverage other sort of networks, other resources, and ultimately expand the capacity of what we're doing. So thanks, Andrew.
Thank you, Michael.
Building on what Michael just was talking about, the work that you guys are doing is really exciting. I just want to say congratulations. I've been complaining about this for at least a decade, and I'm sure some people a lot longer, about how Canada had a very city-state, kind of ancient Greek city-state mentality, where it's like, oh, I don't really care what's happening in Sparta because I'm in Corinth. They could screw themselves. You know what I mean? Like, oh, isn't that interesting that you're doing this thing, but I don't care. That's not my context. We do have different contexts, and we do need to pay attention to our different contexts, but we have a lot of similarities in our context, too. So I'm very excited by the work you guys are doing. One of the things that I think maybe needs to be built upon, though, is there was for me, as a guy that's kind of a frontline mental health and sexual health service provider, there's a lot of like, we're going to do formative research. And by the way, this is not you guys. You guys are doing a great job, right? So like, you should be really proud of what you're doing. But this is like, over and over again, every conference, we're going to do formative research, and then we're going to pilot a project. Then we're going to do, next year, we're going to do formative research, and we're going to pilot a project. And by the way, is that dramatically different than what we've been doing at ASOs and other organizations for decades, where we ask people what they think, and then we pilot a project, and then the ASO worker leaves, or now it's called the GAYSO worker leaves, and then there's like something new, and now we're going to pilot a new project. So I worry about that, and I, kind of want to know, as far as leveraging resources, we don't have a ton of resources to do this work, but what could we do to leverage resources so that things don't end at the pilot stage and can be rigorously evaluated, so that we can actually move forward and like, oh, things change over time in our field, right? But that we actually have stuff that like, this is what we did last year, and we're going to do it this year too, and we're going to do it next year as well, because we know it works.
Thanks, Trevor. Again, I think that's an excellent point. I think all of the presentations have attempted to touch on the different ways that we are on the one hand trying to address knowledge gaps and implement a series of activities to help address those. But we're a diverse country, and we do need to sort of exploit all of the great work that has already been done, and that is primarily happening. It's not only in the big cities of Montreal, Toronto, and Vancouver. I think it is important to recognize that there is other local and regional or provincial work that is happening beyond those cities as well that does need to be taken into account. I think now that the project has kind of established itself, and we are sort of formally launching the project today, I think one thing that we definitely need to do is to prioritize our relationship with researchers and other sort of folk who have sort of like that experience in implementing effective interventions, so that we can really bring them on side and make sure that what we're doing isn't sort of duplicating things or sort of like ignoring the vast body of important work that is already in place. So thanks, Trevor.
I may also add to your point of sustainability and continuity in service delivery, which is really, really important, not building expectations within our community and then, like you're saying, these programs leaving and completely dropping. So in the context of what we were presenting today, obviously, I think everyone mentioned still working on work plans. So there is still a lot of work to be defined for the next 5 years. And I think a lot of what we presented is year 1 and year 2 of the work that we're going to be doing. And I know that at Max Ottawa, that's something that is always continuously on our minds. So we are looking at how we are then, piloting interventions, but then how can we use the data and the evaluations that we've used with our pilot interventions to then go and seek more money to make sure that these programs can actually live and stay within the community as well. So, I think, I'm not sure if I'm the only one that can speak to that, but I think it's probably relatable to most partners.
Well, thank you so much, everybody. We don't have enough time.
Please come talk to us if you want any more questions, if you want to chat about any of the specific projects or activities that we've been talking about today.
You've now seen the faces, you know their names, you can reach out. And also like us and follow us. I haven't seen much of that happening in the last hour and a half, so please do it.
Looking at you.